The first thing I was going to say is, and I know the very farthest back people are people I work with, but if everybody wants to come up closer, that would be great. Because what I want to do is I'm going to do the slides, but I kind of would like some time for it to be interactive. And that's primarily because I have a very short attention span, so I assume everybody else has a short attention span. And so I'm going to try to go through the slides fairly quickly about the talk I'm going to do today, which is on girl-child marriage. But then I thought we could really focus on some questions, some answers, and some dialogue, because the theme today is be the change you want to be, and I thought, it's probably more important that we, once thinking about the issue, can kind of talk about how do we want to be the change on issues like this. Does that sound okay? All right. So my talk today is on the elimination of girl-child marriage. Why? Why do we want to focus on this issue, and how do we actually address it? So first of all, I want to say, if for those of you who aren't familiar with girl-child marriage, it is very specifically about marriage prior to the age of 18 years. This is an arbitrary idea. Why 18? I don't know. Why is 18 to vote? This is considered legal consent in international spheres, and it's certainly the case as recognized in the U.S. But there are differences across regions, across countries, and I focus a lot on South Asia. In South Asia, the laws are 18 for female in all South Asian countries except Pakistan. So if I were to ask you, based on that, which is the country with the lowest rates of girl-child marriage for India, Pakistan, Nepal, Sri Lanka, based on the laws, what would you think? Just shout it out. Which country? What? The lowest rate of child marriage. If all the countries except Pakistan have have an age of legal right to marriage at 18 or older, except Pakistan, which country do you think would have the lowest rate of girl-child marriage? Would you think it's Pakistan? It is. It's Pakistan. And what that tells you is that laws are important, but they are inadequate to actually address this issue, which is very socially entrenched. About 14 million girls every year are married before the age of 18. And we're going to talk a little bit today about why this is a problem, because some people don't feel that it's an issue. We in public health, I should have started that way. I'm actually a professor of medicine and global public health, and I'm also the director of the Center on Gender Equity and Health. And we feel very strongly that it is a problem based on substantial data on the health implications of girl-child marriage, and I'll talk about that. So it is a problem, and I believe it is the single greatest impediment to reproductive, maternal, and child health that we could actually eliminate in a single generation. In 20 years, we could eliminate girl-child marriage if we escalate the path of reductions in child marriage. If we can accelerate that path, it can be eliminated. And so that's a big reason we focus on the issue. So the goal is to eliminate girl-child marriage by 2030. This is a little bit about where early marriage and young motherhood occur. So you'll see another point on another slide, a statement I'm going to make now, which is 95% of adolescent childbirths in low and middle income countries occur in the context of marriage. Here in the States, we think a lot about adolescent pregnancy as something occurring outside of marriage. That isn't the case in much of the world. So early marriage is a primary risk factor, probably the greatest risk factor for adolescent pregnancy in much of the world. In particular, and you can see the darker shades are indicative of higher rates of adolescent childbirth. South Asia has the greatest numbers, but you can see the darker shades are in sub-Saharan Africa. So sub-Saharan Africa has the highest rates, but about 40% of child marriages occur in one country, India. It's where I work. And that's because you have a huge population. So even if it's a smaller proportion of the population affected, the numbers are great. Sub-Saharan Africa, though, you could go to a country like Nigeria, in areas, 70–80% of the girls are married before they are 18 years old. Some as young as 8, 9, 10. How many of you have heard about the kidnapping of girls in Nigeria recently? Yeah. So did you hear the idea of, quote, selling the girls? So one of the reasons that is that people will do this is actually into marriage. They will sell girls into marriage in areas where there's lower girl availability. But let's talk about what's going on right here in San Diego. We are right by the border, and actually Latin America is the only region in the world where we're actually seeing increasing rates of adolescent childbirth. And that's quite important, and it has huge bearing on what the health and development in these countries are. So you can see that all world regions are affected, even the US. What causes girl-child marriage? Well, there's a number of things that we think of that really give rise to the issue of early marriage of girls. One is social inequities. These are things like poverty, residing in a rural area, lack of opportunity. A big one is lack of education, but particularly lack of education for girls. And this really creates a climate where early marriage is more likely, and that it maintains sort of a marriage in a way of power imbalance where girls are less likely to be able to negotiate their marriages because there are some, their views of having value in that context are lesser because the boys are more likely to bring in income. They're more likely to work in the agricultural areas. So there is a benefit of girl child marriage to reduce the number of girls you may have in a household when you have a more impoverished situation with low resources. But that really coincides with gender inequities. So things like dowry, bride price. If you have a situation where a girl, it's going to cost you money to have your girl married, right? Then what you're going to do is you're going to maybe try to do multiple weddings at the same time because the wedding itself has an expense. And you may do a deal where she's marrying brothers because it can reduce the dowry expenses. So these are ways the economic climate can affect decision-making around marriage. But it has a greater vulnerability for the girls than the boys because of traditional practices like expectations that it's the girl's side that pays for the wedding, expectations of a dowry. Even bride price can have an effect. Are you guys familiar with dowry and bride price? Do you know dowry? Yeah, okay. Do you know bride price? So bride price is that the groom will give maybe like cattle or something to the girl's family to be able to have the bride. So you'd think it's like, okay, well now this is going to work to girls' advantage. But what we can see in, for example, the Maasai community, are you familiar with the Maasai tribal community nomadic community of Kenya? In that community, they have bride price. And so what happens is the boys have to wait. They marry at an older age because they have to have enough money to accumulate the wealth or support their father to accumulate wealth to be able to pay the bride price. But the girl remains young when she marries. So not only is she marrying young, you're creating a differential in age. And a 13-year-old marrying a 22-year-old and becoming sexually active in that circumstance is very different than 16 and 17-year-olds being together, right? So these are a lot of the issues of early marriage with regard to gender equity. What also can happen is that you have a situation of something called, in Afghanistan, we've done work around badal, Badr badal, and that is like there is tribal conflict. There's conflict between two communities or two families. And they will have the families marry. So like, let's say, I'm just going to give you an example. Your son killed my son, right? In reparation, you give your daughter to my family in marriage. How do you think I feel about this daughter? How do you think I might treat her? So these are issues of traditional practices that really heighten the vulnerability of girls based on the gender inequities in place, and the social norms and traditions. So we talked about dowry bride price, we talked about bad badal. Sanguinity is also an issue because if there is a tradition in a family of marrying cousins, those are often decided before children can be, at times when they're infants or possibly before they're born. Your opportunity for choice is great. Also, there is an attitude when things are decided so early, why wait? It's already been decided. And this would be a good time. It would be a convenient time. And there's not a whole lot of thought given to where the girl is in her maturity and readiness and her willingness and comfort. So these are all issues that affect the situation. Very traditional, low-resource situation with norms that reinforce gender inequities. And that's kind of what we talk a lot about in sub-Saharan Africa and in South Asia. But increasingly in these contexts, there is a situation of the girls actively seeking, particularly in later adolescence, the opportunities to marry, particularly if she's trying to leave a household. And this is sort of similar to what we might see in the US. Girls that are in abusive situations at home may look for the opportunities to leave through a male partner. But what that does is it enforces a situation of him having greater power because she's leaving and is now dependent on him for survival, right? So these are real concerns, and what they can often result in is trafficking. And so what you find in the border, there's a study that was done recently by people in our Center on Gender Equity and Health, and what they found was the majority of girls who entered sex work under the age of 18, right here in Tijuana, the majority of them also married under the age of 18, also had children under the age of 18. So their vulnerabilities, and it not uncommonly were trafficked, entered sex work at a young age through the person who married them, or due to abandonment by the person who married them. So vulnerabilities are quite substantial to various forms of gender-based violence. There is some variation if you have the early marriage and then the pregnancy, but also what you can sometimes have is a pregnancy and then the marriage. And that's more common around what we see here. So if I say to you, Bristol Palin, are you familiar with that story? Do you guys know who that is? So if you remember, Sarah Palin's daughter was pregnant at 16. And when one of the things that happened at that time was, oh, she's pregnant and now she's engaged. As if that's gonna help the situation. And I'm not arguing for or against, but I want people to think about it. This is often believed to be a way to address a teen pregnancy, is to have youth marry who may not have intended to marry, whose relationship may not have been inclined to marriage. And frankly, we do know that girls who become pregnant in teen are more vulnerable to having been victims of dating violence by their partners, are more vulnerable to sexual infidelity from partners. So this is a really important statement that we give our girls when we say this is going to be the resolution for you, is to marry boys knowing that in fact they are more likely to be abusive or cheat on them. Okay. All right, so what does this mean? So that was sort of the social thinking around it, but what does it mean in terms of health? That's really where I come in and where our research is designed to contribute. So as I said, 95% of the adolescent births in the developing world occur in the context of girl-child marriage. Why does adolescent childbirth matter? Because 23% of the overall burden of disease due to pregnancy and childbirth, including maternal mortality, is caused by adolescent pregnancy. That young age at pregnancy and delivery severely compromises the health of mothers and the reproductive process, so delivery and likelihood of survival. 65% of obstetric fistula cases, 65% begin in adolescence, and as a consequence of adolescent childbirth. And in conjunction with that, we also see that these girls who marry younger, who enter into sexual activity younger, are less likely to use contraception because their reproductive control is severely compromised. They are more likely to be reliable on others for mobility. They are more likely to be reliable on others for permission to access healthcare services, in particular family planning. They are more likely, as I said, to be in abusive relationships where their ability to use contraception is compromised by the husband or partner's willingness to allow them to use it. So what we see is a combination of lower likelihood of being able to have the reproductive control and higher risk for the mothers and the children, we're about to talk about that in a minute, when reproduction occurs at the young age. So what is the higher risk for the children themselves? 50 to 100% higher risk for neonatal death, infant and child mortality as well is affected. Preterm labor, low birth weight infancy, and child malnutrition. So we found in a study we did was that early marriage of girls affected the likelihood that they had a malnourished child under 5. What happened? Even controlling for resource. What we think is happening is physiologically, you have a growing girl who is now having to compete for her nutritional resources in the context of pregnancy. That's compromising her health, and it's and her nutritional status, and the fetal nutritional status, and ultimately the infant and child's nutritional status, her ability to breastfeed in a healthy fashion, and all of that has long-term consequences for the health and the survival of these children. In addition, there are a lot of social ramifications. So it severely affects the social development and opportunity for girls. A girl who marries who is being educated is more likely to be taken from that education. Yes, a girl who doesn't get access to education is at greater risk, but if the girl enters education and child marriage is a norm in that community, they are far more likely to drop out. And they are more likely to live in poverty, and the cycle of low development and poverty continue into the next generation. Their children are more likely to be affected. There's also issues of mental health and social support that are compromised. Girls are literally taken because of the tradition in most cultures, and I would argue even in our culture, of what we call patrilocality. Girls are more likely to move to where male partners or his family is. Women and girls are more likely to move for the male, and this is a very heterosexually biased talk, I'm gonna own that right now. They're more likely to move for a male partner's job, right? So all of that leads a trend of less social support in her life. She's more likely to not have the social situation that was based on her social support networks. Mobility restrictions we already talked about, and then not surprisingly, this issue of suicidality and other mental depression and anxiety is a grave concern for these girls. So I've done work in Afghanistan, and there was a review of the medical records of women and girls who were burning themselves alive. They were literally, because this is they have chula, it's a stovetop, and you use the gasoline, the kerosene, so they have access to this. And this is the way they would choose to kill themselves. And you can tell when it's self-inflicted because of the way the burns come on the body. And most of the victims at the hospitals will come in at about 70% of their bodies burned. 80% do not survive. If they survive, the life can be very difficult because the complications from the burns can be quite severe. We found that the two primary predictors of women or girls burning themselves alive is, number one, violence from partners, and number two, child and forced marriage. They were doing it prior to try to avoid a marriage they didn't want, or subsequent to a marriage that they were too young to have. So, as I said before, this is really associated with a lot of the issues around gender equities, and this is a big focus of the work of our center. So it's going to be increasing the risk for partner violence. It's more likely to happen when the context of when there's female genital cutting happening. It is linked to sex trafficking. As I mentioned before, forced marriage, sanguinity, son preference. It is more common in a context where there is preferences for boy versus girl children. So I'm trying to intersperse this with a little bit of different studies we have. So in India right now, in the past few decades, there's been a situation of a declining number of girls relative to boys. It is now at about 914 girls for 1,000 boys. And the age group that is most likely to be affected is now the age group that started, where you start to see the rates have increased, is now reaching marital age. And what's happening is the boys don't have enough girls. So they're literally kidnapping girls from other areas and bringing them into marriage. They force the marriage, and once sexually active, it's viewed as in her best interest to stay in the marriage because she could not have other alternate choices at this point. And this speaks volumes because there's a lot of work done on prevention, not so much done once a girl is married. It's much harder in a lot of these contexts to do something then. There's also inhibited access to sexual and reproductive health education and care, particularly when unmarried. So girls are entering into their sexual and reproductive situations without enough knowledge and enough access to health services. And they actually can be restricted from healthcare acquisition because healthcare is less available, but it's also less a norm in these areas. So these are just graphs that I'm showing you, which are at a national level, and I'm not going to go into detail, but that slope basically means that countries with higher rates of infant mortality consistently show higher rates of girl-child marriage. Same holds true for maternal mortality. And the regions most affected, again, are Africa, sub-Saharan Africa, and South Asia. So what do we know? We know that child marriage is pervasive, and it's particularly pervasive in some of the poorest and least developed areas. It's culturally entrenched, but it also displays a little bit differently across cultures. And it impedes maternal and child survival, which has major social and health ramifications for the girls and their children long term. So what's the solution is sort of the next question. The goal of most people is like, if we can just get the girls educated, if we can just get the girls educated. This is actually a chart across 4 countries in which we're working, Bangladesh, India, Nepal, and Pakistan. And what you can see is a steady increase in girl education, correct? So let's just take India, for example. There are natural declines in child marriage occurring. Any guess as to how much of a decline we see year to year? How much of a decline do you think there is in South Asia? 1%, 5%, 20%? What do you think the decline is? Throw a number out, it doesn't matter. It's 0.5%, 0.5 to 1%. So the level of education is increasing at a rate that doesn't correspond to the early marriage of girls. And that made us call into question, could girl education have the impact that we believe it could have? So we did analyses on this, and what we found was primary education, which historically resulted in a lower likelihood of girl-child marriage, no longer has an effect. It is not enough to get girls into primary education. Secondary education does, however, have effect, but it only affects girls until about 14, 15. For 16 and 17-year-olds, what we are now seeing outside of this does not include India, but in the other countries that we've been looking at, by 16 or 17, secondary education has no impact on girl-child marriage. You know why? Because most of these educational systems end in 10th grade. Guess how old you are? 15, 16. So every time you send a message out and say, we should get girls educated, that will deter, that in these communities reinforces a message, she will finish school first, and that happens at 16. So it's a really important issue that we're going to have to change the agenda around and talk about post-education opportunities for girls. So that's one solution that I think is really important. Another solution is we believe is youth leadership, and I want to just take a few seconds to talk to you a little bit about some of the data we collected in preparation of a youth leadership program we call Youth Care. This is a survey we did with girls, boys, and their parents. So these are unmarried boys and girls. And I'm just going to take a second and just show you some of the things that I thought were interesting. Most people did not feel girl-child marriage was beneficial. However, when it came to whether or not girls should have the right to choose who to marry and when to marry, look at how many people, particularly the fathers, felt that should not be within the realm of girls' choice. Girls themselves in this rural Indian area that we worked in, or that we continue to work in, 1 in 5 did not feel that that was their right to choose who to marry. So the notion of helping support girl choice is something that is really difficult if these values are culturally entrenched, and this isn't a fundamental value of where they are. Also, I'm really concerned because I told you about the reproductive health issues. I was particularly struck by whether or not contraception should be used in marriage in this area. This is an area with very low rates of contraception until sterilization. So what was most of concern to me is that the population, or the group that we had that had the most negative attitudes towards contraception in marriage, were the girls themselves. So the opportunity to start not just educating, but supporting girls to know what their options are and why they might be useful and what rights to choice they have, or even if you don't say, well, you can't affect the parents, but if the girl doesn't know she has the right to choose, then she will never even think about what that choice might be. And that's an incredibly important first step that we have to be working on. Below, you can look the lots of attitudes of acceptability of violence against women, or violence against wives is also there. So we have a youth care peer-led program where we actually have been training boy and girl youth care advocates to work in their communities by having conversations, just conversations about these, to try to help instill a sense of, no, it's your choice, but at least know what you want and make an informed choice about why you might want it before you get into marriage. And let your choice be known to your parents. We can't promise you they'll be listened to, but our experience having worked in these communities, parents are more willing to listen than are kids able to recognize their parents will listen to their choice. And that is something that we think the youth care advocates can really support the kids to do. What's really nice about it, though, is those youth care advocates were picked on the basis of their parental support, which allows facilitation of parents to be able to talk to other parents about it. Another concern that I have, and this is because young leaders can really create the social change we want. I'm going to do this really fast and close so we can have time for discussion, but one of the concerns I had is we don't do enough after marriage. And one of the big issues is a lot of these young girls don't use contraception and don't have control of whether or not they can use contraception. A lot of times it's in the context of India in which we work, it's a lot of times mothers-in-law that have those decision-making powers, and men are disengaged. It does nothing to do with them. What we decided to do was, we thought it was going to be harder to change mothers-in-law because generationally this has already kind of been an accepted norm for them. So we started working with men, and we had male providers reach out to men to talk about these same kind of issues we've been talking about today. And it's the health provider, so they had a credible voice of men talking to them. A final session, so there was a session required for men, a reinforcement session for men, and then another optional session for the couple to come in together. About 50% of people came in as a couple, and we realized that we actually need to get women providers there because we think that would have increased the likelihood that the couple would have come. So that's a goal for the next study. But in any case, what we found was that really high participation in the program. People didn't think men would come. 91% of the men we approached came to the first session. 77% came to the second session. The second session wasn't required. So this is showing a huge amount of engagement. And let's see. And then we did, you don't have to look really carefully at this. This is for anybody in methods that's really interested in the methods. But the bottom line is what we wanted to do is we have 9 and 18 months following these couples up over time to understand what is the impact on their reproductive health behaviors. I'm just going to share with you probably our primary finding, which is contraception use. So at time 1, you can see that, that contraception use was reported by fewer than 30% of our control and our intervention groups. We had 2 groups, so there was a group of comparison. But basically, you don't have to look at the numbers that carefully. You can just trust me on this. There's about a 60% increase in contraception use for the people that got the men's engagement intervention. And that, I think, shows an important way that we can work with the husbands after the marriage to help support them so that they're not reinforcing some of the issues that we've seen, such as non-use of contraception or violence, et cetera. So what are the solutions that work? Girl education's key, but it's inadequate alone. Youth leadership shows promise. Male engagement-focused family planning shows promise. And while I started this discussion by saying that you need policy change, that policy is inadequate, but in the absence of policy, you cannot alter the social norms of the community. So in places where we do see that it's acceptable, we've got to work internationally to make those changes. All right, that's it. Thank you so much. And we have how much time for? We have about 9 minutes, so questions and answers or discussion. Oh, thanks.
How do you engage with the communities in a way that doesn't feel like you're sort of foisting your cultural ideals upon them and sort of trying to change long-standing traditions? How do you, what is the leverage that you use, and how do you partner with the communities to make changes this way?
That's a great question, because you could look at this and just be like, yeah, fine for you to not believe in dowry, but that, right? So we work with the government of India, and what we do is we actually work with so right now we're in rural communities in India, for example. So in those situations where we're trying to do on-the-ground projects, we actually develop the tools, the questions based on what the community leaders are talking about. So for example, the study on youth care, that was supposed to be a study on child marriage. But in speaking with some of the other people, key stakeholders, health providers working in the community, et cetera, they said, ask them about contraception, ask them about the issues of abuse and violence, ask them about alcohol. And so it gets expanded in that way. And thank goodness we listened, because they were right. The child marriage thing didn't come up. So there's a lot of, and it's long-standing work. We've been working in the communities in which we work and with the partners we work, we've been working there for over about 15 years, 10, 15 years. Right? Maybe 12, yeah? Not 15. I'm not that old. No, I am that old, actually. But then the other question is with some of the large-scale studies even, we think about the same questions. So we ask when we go to these local communities to think about so we try to find out what's going on, right? And at the same time, we work with the advocacy groups that are on the ground and already working to help guide our research questions. Then when we get the findings, we go back to them and say, how would you interpret these findings? And then when we interpret the findings with them, that actually can give us more insight into what's going on. So for example, one of the issues with male engagement that we had never heard, we had never seen in the literature, we did some formative research in the community there, and we had never even heard it from the NGOs working there. People started, when we talked to men, they started talking about that if you start as a man talking about family planning, that says that she leads you around. And if you start doing that, that's like going against your own parents. They made a leap that we didn't even know. So that went into the development of the curriculum. And the curriculum isn't developed by us, for CHARM. It's actually developed by the healthcare system, and we just support it by giving the evidence. So those are some of the ways. Other questions?
That was a surprising finding with the 86% of girls, so much higher than the other members of the population, being opposed to contraception in marriage. Do you have any more information on that as to why?
Yeah, so we think that the following reason, if you looked at the numbers, so the boys were slightly older than the girls. We think that age does have to do with it. I think with age comes recognition that mistakes happen and that control is needed, and that financial responsibility is part of decision making. And so I think there's that piece of it. If you look carefully, the parents actually were more supportive than the children, and I think that speaks even more to the fact that when you are directly in that situation, you really realize what it is. So I think part of it is the naivety of youth. At the same time, the very fact that in a naive circumstance, I've seen people have these conversations about other things as well. A young person would be like, I would never drink alcohol. But as you get a little farther up, they start thinking about, well, if I did it, I'd make sure I wasn't driving. I think that's going on. But the very fact that they don't think it's okay, that that's their starting place, I think, that was something that the community was really surprised by as well, and it made them real, because there's not an opposition in that community. There's not an aversion. There's no religious restrictions on. There's nothing that would have told you contraception wouldn't be acceptable. So people were very surprised, even for the adults, to have that feeling. Yeah. I think I know the program you're talking about, which is, it was a vasectomy program, and it was a bit of a forced vasectomy program. And so India actually has the oldest government-supported family planning program in the country. It actually has done an amazing job. They were able to move fertility rates to from about 6, and now it's about 2.5. The goal is replacement fertility. So there's been a big shift, but what happened was that shift came in the form of sterilization. So our concern is that when you have contraception, it's like there's no contraception, and especially this is a concern for young girls, and then about 30 or so you might get the sterilization. The vast majority of people in the country follow this pattern, and then it's female sterilization. Male sterilization in the country is about 1% or less. Strikingly low. And most people attribute it to the Indira Gandhi program, where there was a forced sterilization, what many people feel was a forced sterilization of males, and there was such a backlash against it. It really, really affected, and by the way, I think there were a lot of, complications, medical complications due to lack of sterilization and things like that. That's a huge concern. We've also felt it, we've seen this with female sterilization even in this country, that forced sterilization is unacceptable. Reproductive choice needs to be our goal. And if that choice is you don't want to use any contraception, then we accept that you don't use any contraception. But we feel that choices have been too restricted in India, in part because of this focus on female sterilization only, and to the detriment and absence of male sterilization support. Other questions? I'm optimistic, but I think I'm very optimistic. Yeah, I mean, when I see that the rates, like you can even look back at 50 years ago, it was 5.5. Now you're seeing very steady declines. It's mostly happening in the urban areas, and that's because in the urban areas, you take somewhere like Mumbai, they don't even have replacement fertility anymore. It's less than 2 there. And that's because it's getting expensive, frankly. So I'm optimistic for change. I think what I want us to be careful about in the approach is to ensure that with the goal of change on these pieces, that one, we ensure that we are not putting our ideologies, and not just Western, but the notion of upper class and educated onto communities, but also that we do it in a thoughtful way, because they didn't do it in a thoughtful way with the male sterilization, and the effects of that are longstanding.
Let's see. So I was surprised by the fact that early education of young girls did not seem to change the percentage of those that were going into these younger marriages. But have there been any studies or intents to study education of young boys? Since their position in the community seem, in their culture, maybe there's data to suggest that there's an integration of women's education to the young boys as they grow up, if that would change that number.
It's such a great question, and I think there's really been an adequate study of that. And something very interesting has happened in Bangladesh, which I think we need to watch very carefully, because what's happening right now is the girls are more educated than the females are more educated than the males that they're marrying. But here's the thing, the males still are the primary earners, so they still have the economic autonomy, and we don't know. So it's one of the things about this whole girl education. I'm a real believer in it, and I'm a real believer in universal education, but I think you're right, we don't understand that. And, as a mother of a boy, sometimes the messages that are designed to support girls can create a backlash with the boys that doesn't serve the larger good. So I think you're really right to ask that question, because if we push hard for girl education as a solution and don't take a moment and see, okay, what's happening with the boys, and how is that affecting it, and how does that interaction of girl and boy affect things, it's huge. I think one of the things that's happening in Bangladesh is that there's the access to boys and girls, but I think it's a greater economic cost in many of the places in Bangladesh. There's a greater economic cost for the boy to continue in school at a certain point, right? Because he can earn. And now they're finding, this is so interesting. Have you guys heard about the factory workers in Bangladesh, and girls and young women are being killed, right? The conditions are just abhorrent. And at the same time, what's simultaneously happening is it's giving girls economic autonomy. And they're giving them value in the family, because now they're earners sending money home. And it's far more complex than you know what, we should just stop this. So I love that you asked the question because I haven't, and I think we do need to. Is there anything else? All right, thank you.